Hey y'all, Dr. Wells here from St. Augustine Beach. I'm here to talk about the top tips for fighting frailty and bone mineral loss. So this is a good one for our older adults, our PTs working in geriatrics, but really can be for anyone, particularly even middle age, right? Bone loss doesn't happen just when you're 60. It's usually a progressive thing. And so these are the top three studies I really want to focus on today. So one big thing was a 9-month randomized control trial. They looked at utilizing resistance training with vitamin D supplementation, and they saw a small but meaningful increase in bone mineral density in their older adults. So for PTs, maximize bone growth, we need to be asking patients, are you taking vitamin D? If so, how much? And then coordinating that with their primary care provider. I know it was probably about almost 10 years ago, I published a platform presentation at CSM on a case study of a woman with severe osteoporosis. I coupled it with resistance training. We focused on ensuring that she had optimal vitamin D with her primary care. We did full body loading, and she saw significant improvements on her Z score. So it is possible, and it's something that PTs need to be more engaged and aware of. Number two, so using high quality diets to prevent frailty in the first place. So we know that pro-inflammatory diets that are rich in ultra processed foods can increase inflammation. We also know dietary patterns that are high in inflammation, like a high alcohol meat type diet, produce acidosis, which can create leaching of some of that calcium carbonate from the bones to promote osteoporosis. So studies show consistently that diets like the Mediterranean, the DASH, or healthy plant-based diets can help reduce some of that inflammation, and it's strongly associated with a slower progression of frailty. So we as PTs, we need to be talking about their diet. We need to be looking at their dietary pattern. And again, doesn't mean you need to be prescribing that diet. You can refer them to your dietary services, refer them to your dietitian who's, a couple streets down. It's important that we talk about their diet and their quality of their diet. Lastly, we need to make sure that these patients maintain vitamin D status over the long term. So maintaining a modest level is okay, but daily requirements are typically 800 to 1,000 IUs per day. So meta-analysis reveal that vitamin D levels are important, not just in the short term, but overall in the long term. And so that's why oftentimes I recommend my patients to take it. And we know that there's a lot of associations with vitamin D status and other diseases. Moreover, as we talk about in our three-part course series for nutrition and PT, vitamin D is associated with balance, as well as there's some studies coming out on cardiorespiratory fitness. So patients with higher levels of vitamin D have better muscle performance, and that's because there are actual receptors on the muscle that can help stimulate the muscle. So that vitamin D plays a role in multiple areas because it is more like a hormone, not just a key for calcium. So these are the three real big insights for us as PTs and rehab professionals. If you want more for your geriatric patients and more for your patients in general, you check out our courses at nutritionalphysicaltherapy.com. Sign up today and save some money and have your patients getting better faster.